Okay, I'd like to welcome everybody to the Cooperative Extension Campus County Connection Series. If you are new to the Campus County Connection Series, I'll let you know that this is our intention here is to share with you a little bit of good work that's happening both in extension and in research, and just share the integration of the two of those things and how they can work well together. So today's topic is community planning across generations, and I'm very excited to be here with Dr. Mildred Warner, professor in city and regional planning, and she's going to share with us some of her research and practice, and it's a really great presentation, so I'm excited to have you here with us today, Mildred.
Thank you.
A couple of just insights for you to help you get started, whether you're new with the Campus County Connection series or new to webinars, or maybe this is maybe you've participated in a bunch of these, but this is being recorded, okay, so I'll share that first. Also, just in terms of some logistics, this is housed in the Event Center of WebEx, so there's a couple of things that are unique to the Event Center. One is that you are muted upon entry, so you probably noticed that. There is an opportunity for you to share your dialogue and questions, and we would encourage that. And I would love if you could do that through the chat. So you have the chat and you have the Q&A, but please use the chat. I'm going to ask if you can hear me okay, if you can go ahead and put something in the chat right now so we can practice using that. And if you can set your chat to all participants. Yeah, it looks like I've got a question, a hand up from June Mead. Oh, so Bev can hear us okay. June, I'm going to try to find your question. It looks like it may be in the Q&A.
She can't hear you.
That's early on, so I'm not sure that that's still valid. I just want to make sure that there's no question all set. Okay. Phew. All right. Your hand. We saw that your hand was up, June. So, all right. So with that, a couple of other logistics. We have some specific points that Dr. Warner is going to stop at. Slides number 6, 10, 16, and 20 are going to be some pause points. So if you want to be listening up until those points and thinking about what questions you have, we'll be stopping at the end of the intro and theory and the current practices and joint use and collaboration with schools, and then the point where there's more of a gender lens on the current research. So you can put your questions in at any time, but at those places in Mildred's presentation, we are definitely going to be pausing and looking for some dialogue. So just want to give you a heads up on that. I think that's it. So we're going to move on to some slides here. So I'm going to forward on. When it comes time to forward to the first one, I have to do that one, but you tell me when.
Okay. Well, thank you very much, Celeste. I'm really pleased to be able to be here talking to all of you today about a topic that I've been working on for about 15 years, and so I'm really excited to be able to share some of the findings, insights, and questions that this work has raised for me with cooperative extension people from around the state. So thank you very much for having me, and I'll also repeat my website at the end of the presentation, but much of this material you can find at my website, which is simply www.mildredwarner.org, and there's a planning tag under there. And under that planning tag, you'll see Planning Across Generations is one of the options. So many of the issue briefs that you might want to use with your communities, you will find there. So yeah, we can go ahead and forward it. So what I wanted to do is sort of set this up at the beginning with the notion that with an aging population, this creates care needs at both ends of the life cycle. And you see this sandwich generation sitting there in the middle of folks who are having to deal with care issues of their children and care issues of their parents. And it was actually this kind of challenge that I faced earlier in my career. In fact, those are my kids and my grandmother back when I was a person in my early 30s trying to carry on a professional life and a home life. And we all feel that tension. And actually, it's that person in the middle that really can help make things make things move. So when we were looking for a logo for our work, we decided to make the logo really focus in on the woman in the middle. And sorry guys, if there are any guys on this call, the fact of the matter is that despite changing gender norms, the data show that men have picked up about 2 to maybe 3 hours a week of extra household work in all that time period. We haven't seen the movement in actual allocations of labor time around care work that we have seen in the ideology. The ideology is much more egalitarian. The reality is that women still share the primary burden of the work. And what we were thinking is that if we took a multi-generational planning approach, we could not only address the needs of a growing aging population, but we could do it in a way that makes our communities better places for children to grow up. And so what we want to do in this is think about 3 issues: inclusive design. I'm a professor of planning, so we pay a lot of attention to the built environment and zoning and those kinds of regulations. I'm also very interested in service delivery, both government service delivery and market service delivery. And so much of our services has been siloed into services for children or services for elders, but not services for all. So what's the opportunity for sharing? And then could this lead us to a common vision, which is something that I think is very important if we're going to move forward on community action. So what's the legitimacy for bringing together a child-friendly focus with an age-friendly focus? When you look internationally, UNICEF has an initiative of child-friendly cities, and the World Health Organization has an initiative of age-friendly cities. And even though they say they're about all ages, if you read their materials, it's really about older people. But when you look at the elements that they talk about as being important, you'll notice that many of the elements are very similar. Now, the UNICEF obviously has some focus on basic needs of services, water, safe streets, because they're working internationally in the global south as well as the north. But there's so many common elements that we think that there's a lot of opportunity to bring these 2 interests together and create cities that are better places for all. I have worked with the AARP on their livability indicators project. I was on their advisory committee trying to make sure that it wasn't just about older people, but also about children, making sure that it wasn't just about urban places, and also gave attention to rural. I was also one of the writers of the APA Aging Policy Guide. And since this one was composed of planners, the primary emphasis in that document is given to housing and the need for a variety of types of housing to meet a variety of needs, the role of land use, and particularly this new interest in promoting connectivity and allowing mixed use of retail and residential, and then transportation, shifting from a commuting to work paradigm to a mobility paradigm, which is how do you get around to do what you need to do, whether that's health or education or childcare or the grocery store or going to work. The report, the Aging Policy Guide, which you can find on APA's website, and is actually a useful document for communities, really emphasizes those first 3. But I would argue, and I think cooperative extension educators would agree, that the bottom 3 are equally as important and may actually be foundational to the top 3. So economic well-being, looking at the issue of an economy that pays attention to care work, not just market-based work, and that's inclusive of all ages, the critical role of community assets, services both in the formal government or market sector, and also services that are provided through informal neighbor and family supports. And then finally, the critical importance of participation, especially across age groups, class, race, and gender. Those 3 elements got shortchanged in the word count in the APA Aging Policy Guide, but my research has confirmed that they're actually the foundational elements to then achieving the top 3 in terms of actual changes in housing, land use, and transportation. The other problem that we face with the current state of the literature on age-friendly communities is that it's elder biased instead of all age biased, and it's urban biased. And yet the majority of elders live in suburban and rural areas. And what we know is that people want to age in place. They don't want to move. Now, the built environment at new urbanism is about this notion of walkable, mixed-use neighborhoods that are relatively dense. And if you don't already live in a place like that, it's really difficult to change your neighborhood to look like that in the short term, especially if you're in upstate New York, where we are losing population and we don't have a lot of developers interested in redeveloping our communities. So the challenge in New York State is for us to think of how we can support aging in place and respect the current location choices of seniors. In fact, make our communities better places to age in place where you currently live. And the question on this is, can a multi-generational approach help us get there? And will this help us build the political will for investment? So anyway, at this point, I'm going to stop. I don't think we have anybody putting a question in on the chat box yet, but if somebody has a question on this first sort of intro setup, we can take the question before we move on to talking a little bit about a theory for this work.
So while they're putting in questions, because they may have some, or a comment. Comments are okay too. I just wanted to share with you that it was a presentation that you did at the Community and Regional Development Institute last summer that I heard about this that just piqued my interest for a variety of reasons, but one of them is that I'm the sandwich generation. My father lives with us, and I hadn't realized how we live in a village, and so we have sidewalks. We're pretty close to a grocery store. We're close to places that he can walk. He doesn't drive anymore. I still have young children, so yeah, they can also do the same thing. And so as you were talking, I was like making note, like, wow, I had no idea. And if communities, small communities, realized that what they were doing was really, you know, like a perfect match, that's a good selling point for the community as well.
Well, it's interesting that you raised that, Celeste, because our governor wants to get rid of villages and have them, you know, basically disappear into their towns. And while that might be a good thing from a tax perspective, because village residents pay double tax, they pay village tax and town tax. So if villages were to go away, town residents would pay more in tax and village residents would pay less. The one thing that villages really have going for them is that they often have what was a historical main street and a little bit of a street grid and sidewalks and the ability to actually implement some new urbanist principles if you think about addressing the challenges of universal design, making it possible for older adults to enter and exit a home, the issue of zero-step entry, wider doorways, and that kind of thing. But our villages actually, because they were built, many of them pre-car, they have the pedestrian walkability features that we now see developed in the newest developments. So this is where, you know, what's old becomes new again. And in many of our upstate villages, I think would really be prime places to think about taking a real leadership role in becoming communities that might attract aging in place. This would be way better than the current modality, which is where developers go out in a green field, build an age-restricted community that's not connected to anything, and then have to run van service and that kind of thing, and isolate and segregate elders into a ghetto. To think of our small villages throughout the state as being places that could be age-friendly, they're already halfway there with a lot of the aspects of their built environment.
All right, I don't see questions coming in, but continue to keep thinking about things that you might like to ask, and just plug them in anytime you'd like in the chat. We'll pause again at 10.
Yeah, so in thinking about a theory for this work, a lot goes in a logo. We spent quite a bit of time thinking about this, and one of the reasons why we made the woman in the middle darker was because she's the one who's going to change the world. Your parents are in denial. They're Peter Pan, they're going to be forever young, and they certainly don't want to have to move. And your children are too young to maybe affect that much policy change. But those of us in the middle, the sandwich in the middle, we're in jobs where we can change the world. And we feel the needs of our children and the needs of our elders, but we're in a position to actually make the change. So the point is, make the change you want to see. And a lot of our work is targeted at city managers, economic developers, city planners, and that type of group. One of the things that's important here is a financial motivation. Now, this is an economist chart that shows government expenditure by age. And what you'll see is that as you get older, there's more government expenditure spent on you. When you see it really, the black line really starts to go up at about age 65. Well, what is that? That's Social Security and Medicare. But you'll also notice that the red line, which is state and local government expenditure, starts to really go up about 75. And you go, what's that? That's local governments having to assume their share of Medicaid when a person goes into a nursing home. That's Meals on Wheels. That's paratransit, which costs about $70 a ride, whereas regular transit might cost $5 or $10 or $20 a ride. So the cost to our communities, even in terms of local budget, is very significant as your population ages, and that's really important in upstate New York because we have an aging society. Let's move back at the other end of the age spectrum, and we notice that there's a big bump up on the red line from about age 5 to about age 18. Well, we know what that is. That's K-12 schooling, which again, the local government and state governments bear the primary burden for. What you'll notice is that in the middle years, from 25 to 65, basically, there's not a whole lot of expense going on. Those are our busy working age life years when we're not actually demanding that many government services. That's probably okay because we're engaged in the economy. The problem is the purple circle, the gross, hideous underinvestment in our youngest, most fragile members of our society. The fact that I live in a society that invests the least in the little children is an aberration. No other OECD country, that's Canada to Japan and all of Europe, no other OECD country spends less on their children than those of us in the United States. And I know that Cooperative Extension is deeply committed to child and family welfare. And if we let the aging of our society cause the older elements of our society to get all the extra government investment, it will come at the further expense of the youngest children in our society, and they are our future. So this is why a multi-generational planning approach, I think, is especially imperative, because we actually need to be spending more on the 0 to 5 age group, not less. Now, how can this, go ahead, please. Here's another piece of the theory. I like to give theory in pictures because I think this may help. The World Health Organization came up with this curve, the orange curve, called the average functionality, and they started at adulthood, so like the 1/3 into my chart. They started at adulthood, and they said your average functionality declines as you age. What we did is we backed up that curve to birth, and we said, actually, you get born, and you learn to crawl, and then you learn to walk. And then when you get in school somewhere, you learn to ride that bike, and the whole world starts to open up to you. And then you get your driver's license, right? And then you're driving along, and everything's cool until you start to get older, and your eyesight's failing, so you quit driving at night. And next thing you know, you're not comfortable. Maybe you get in an accident. You give up your car. You lose your mobility. You lose your social life. You become lonely and depressed. Right? So we can sort of use transportation and mobility, not commuting, as a way to think about what that average functionality curve looks like. So you can see at the two ends of the life cycle, early life and older age, is when you lose functionality. Well, if you want to get to the green line of full capacity in an enabling environment, then what you need to think about is the built environment and the ways in which we can make that built environment more inclusive of all ages, and then service provision that can make up for the differences in the inadequacies of the built environment. So let's think back about to that child that's learning to walk and ride a bike. Do you have sidewalks? Many of our communities do not. Do you have safe streets? Do you have safe routes to schools programs? On the older adult end, do you have curb cuts? Do you have good lighting? Do you have, if you have a wide road, do you have a median in the middle of the road for someone to stop and rest? Have you increased the length, the number of seconds you give for someone to cross the street so that they can get all the way across? When you do those kinds of things, notice that the blue line is even raised for those of us in the middle group, which we're calling adult life here. Because when our children and our elders are able to get around on their own, we don't have to carry them around. And that gives more time back for Celeste.
Yay.
Or Bev.
Or Bev.
Bev's talking about the same thing, right? So that's on the physical side. But many of you are in communities where there's no development pressure. So the opportunity to make major changes in the physical environment, the built environment, you're going to be able to maybe do those over the long term, but you can't do them over the short term. Over the short term, then what you do is you pay attention to a service overlay. So we have walking school buses where seniors, actually, who have some extra time, help walk groups of children to school to help keep them safe. We have elder driver programs where these can be either formal in the market, or there's something called ITN, Independent Transportation Network, that works with rural communities to help develop co-ops of drivers willing to help drive people around to get them to services if you don't have a elder transport service. Again, these kinds of services, whether they're formal in the market or informal unpaid volunteer things, they also raise the functionality for those in early life and those in older age, but they also raise functionality for those of us in the middle, the sandwich in the middle, because we get some time back. Our dependents get independence, and we get time back. Now, there's another reason to do this work, and I'm going to name it, folks, and it's called racism. And we've got a big problem with it in America right now. And the presidential campaign is only making more clear how serious the racist undertones are in our society. Why is this important for a multi-generational approach? Look at this picture. The majority of elders are white, and the majority of children are not. And if we turn this into a war between the elders and the young, the elders vote. Children are not allowed to vote until they become 18 years of age. And the elders will win, and we will lose the investment in our children, which is the investment in our future. So we need to figure out ways to bring the elders and the young together to recognize that common vision, common needs, and the ability to meet both ends at the same time. This is critically important, and you can decide in your own extension work whether naming the racist and ageist underpinnings of this is necessary or not. But we do need to be aware that that is part of what drives it, and we need to be thinking about what that means for program design, giving people opportunities to come together and recognize commonalities of difference. There's also the difference of class. If I could show this in this chart, do you know that in our upstate cities, over 50% of the African American children are below poverty level? We practice in New York State a system of racial apartheid for young, poor children. Their education rates in Rochester, less than 10% of African American boys graduate from high school. These are problems that should be front page problems, calling the attention of our leaders. They don't. And the reason why they don't has something to do with the divisions in our society. We need to bring this together, and I think a multi-generational approach can help to do so. All right, now I've been really provocative, so at this point, maybe somebody has a comment or a challenge or a question. But once we leave from this piece, I'll start telling you where we're at, what our national surveys show about where we're at on this work across the country.
So anybody have any questions, thoughts, suggestions, comments? Go ahead and you can put them in the chat, or I have Q&A open now because some people do like to use the Q&A. So use what you're comfortable with. Are these, so this particular graphic is from PolicyLink 2011.
PolicyLink is an interesting organization that came online probably around about 2000. And their tagline is quite lovely. It's equity is a superior growth strategy. Equity is a superior growth strategy. And their other tagline is lifting up what works. And I think there's a hint in both of those. So they're very, very concerned about race and class discrimination in American society. That is why they do their work. But they do it from a very positive lens of lifting up what works and calling out that equity will get us to where we want to go better than the inequitable strategies that we currently privilege. And so you can also go to their website, and they have lots of wonderful materials there if you want to address some of these questions. Policy Link, they're based out in Oakland, California, but they have national reach.
This is a great visual.
Yeah, they developed this visual using PUMS data. It's very, very difficult, and what I'd love to do is have this visual also by income. But we all know that African American and Latino families have the highest rates of poverty. So I mean, you can almost throw a poverty lens on that, and it would look very similar.
Okay. So we should.
The next one.
All right. Try using these ends there.
Nope.
Sometimes these things get tricky.
Okay, so where are we now? So what I did back in 2013, I partnered up with the International City County Management Association to do a survey of all cities, towns, counties, and villages in the U.S. to look at attitudes of city officials, the actions they were taking, particularly in zoning and planning, around planning across generations. We held focus groups all across the country to figure out what kinds of questions to ask, and we got 1,500 city managers responding, and it was a really nice mix of rural, suburban, and urban places. Maybe 10 or 20% urban, about 20 to 30% rural, and the rest were suburban. So the majority are suburban here. And we asked them, do you include specific language paying attention to the needs of children or families with young children and seniors in your plans? And the answer is no. And then we asked it specifically about, do you have an emergency or disaster mitigation plan? Do you have a comprehensive plan? Do you have an economic development plan? And what we were interested to find out is that more places have emergency plans than comprehensive or economic development plans. And this is because federal law requires you to have an emergency plan. But you know, I don't know if you guys would think that your police and fire department might be your best partners in this work. And in the focus groups, they were saying, no, fire department. I'm like, fire department for planning across generations? Like, what's the connection? The connection's emergency planning. And so if you'll notice, when we ask, does your plan specifically address seniors or children and youth, the emergency plan is more likely to do that. Again, why? Because if there's going to be a flood and you've got to evacuate, you've got to know the people who aren't going to get in their car and drive away. Because we do not want post-Katrina New Orleans in our communities where people drown in our homes because they couldn't leave and we didn't know where they were. When it comes to comprehensive planning, which is like your vision for the future of your community, we're still not thinking about it. Okay, half of us across the country are including some kind of language about children or elders in our plan, but half of us aren't. And this is where the earlier conversation Celeste and I were having about the advantages of the built environment in a village. How many villages in New York State are thinking about themselves as retirement destination locations?
Or destination located, I mean, not even retirement, but just for families.
Well, yeah, for families too, because you can still walk to school if you live in the village, if your school district hasn't put the new school in a greenfield, yes, which is what they usually try to do instead of redeveloping something downtown. And then the worst offenders are the economic developers. Remember I was saying before that we need to think about economic development that looks at care work, even if it's unpaid, as part of the economy. And certainly care work that is paid as a critical undersupplied service in most communities. Child care and elder care, terribly undersupplied. And economic development plans and policies are supposed to be about fixing the things that aren't working well in your local economy. And many economic developers pretend that child and elder care has nothing to do with them. That needs to change. And that will change when more of us, remember that dark figure in the middle that I've made a woman, but isn't always a woman, it can be a man. When more of us in those positions say, you know what, that does fit in my practice. I am going to start using some of my economic development tools to address the home care industry or to address the child care industry. We can do that. We can totally do that. And in fact, on my website, we have a survey that we did in New York State of economic developers, chambers of commerce, and industrial development agencies, asking them to what extent they're paying attention to child care. And a lot of them are. So you can move. This is something we can move on. Okay, what's the reality of our built environment? Not so good. If you look at this list, neighborhood schools, a sidewalk system connecting you to nearby services, a playground within a half mile, which is a reasonable distance that you might expect someone to walk, access to fresh food, public gathering spaces, a retail services and housing mix, complete streets, bike lanes. What you see is that these environmental features are not present in most communities. And when they are present, you're more likely to find them in metro core communities than you are in either suburbs or rural communities. And yet most of us probably find ourselves working in suburbs and rural communities. So we don't have the built environment that we'd like to have. And interestingly, neighborhood schools are least common in rural areas because you have one centralized school, often in a greenfield. Okay, so what about our zoning regulations? Are our zoning regulations, if we ever get any future development, are our zoning regulations thinking about the possibility of promoting connectivity, mixed use, and density? Again, the suburbs and rural areas lag behind in having regulations that mandate sidewalk systems. And we're asking this, you know, in what percentage of your community do you do these things? Parks and recreation, street connections, pedestrian-friendly guidelines. These things are all things that cities are more likely to do than rural areas or suburbs, but rural areas and suburbs also need to be thinking about mobility, walkability, and these kinds of issues, maybe in a way that's more unique to the suburban and rural reality. In terms of allowing child care centers or allowing child care businesses in residential units by right, you see the rural and suburban areas looking more similar to their urban neighbors. Accessory dwelling units is something that I think could be very important. We're now up to about 30% of the planners that answer our planning services saying that their communities are now allowing these. For rural areas where you have large, or suburban areas where you have large homes, we really do need to think about creating a way to have more than one family in those homes. We have a huge rental housing shortage. We have affordable housing shortage. We have the challenge of older adults staying in their homes and making the property taxes with the high cost of, with a fixed income. Accessory dwelling units can actually address a lot of these issues, and we need to start thinking about moving the needle on the debate about this. The research shows that when you allow one of these ordinances in your community, you do not get an explosion in production of accessory dwelling units, which is what people fear, and property values actually go up. We got a comment. The Complete Streets program.
Oh, I think everybody can see Vanetta's comment in there.
The entire parking lot. I can't read this.
Okay, I will. I work closely with the Complete Streets Program and Advisory Board. Our village and town government is slowly starting to look at positive impact of this type of planning. In the past decade, our county government had a large capital project on the county courthouse, which is a central meeting point for our citizens, as it houses DMV, DSS extension in the courts. The entire, okay, the entire parking lot and sidewalks surrounding the building were revised. None of the sidewalks include approaches at street level. Parents push infants and children in their strollers in the roads as the curbing is such a barrier to using sidewalks. All right, and another comment, does research show that these regulations are effective for improving connectivity in practice? In my experience, regulations and policies are not reliably implemented.
Okay, so the first thing is, so let's think about, let's unpack this. Let's have a vision, and let's have a policy, and then let's have implementation. So let's move back to this slide I want to forward to.
Which one?
Forward. This is just the point that services also lag in suburbs and rural areas. But what I want to take you to is the next slide. Wait, I'll have to let you do it. We took this survey that we did of almost 1,500 city managers from across the U.S., and we asked them what led, we put together the elements that we had asked on the survey to see what leads to change. So we had these measures of the built environment. What does it look like? We had the measures of broader housing choices. I haven't shown you those, but they were an affordable housing, a good mix of housing types to meet a mix of needs. And then we had a whole list of services for children and a whole list of services for elders. Then we had the zoning questions. Do you have zoning that regulations that require this, that, and the other? We found that places that have better zoning regulations have broader housing choices and better built environments. Then we asked the question about comprehensive planning. Do you pay attention to aging and children? Places that do are more likely to have zoning rules that support the built environment, the housing and that you need, and then they're more likely to have the better environment. And then we ask, what leads you to have a comprehensive, which are the places that are more likely to have comprehensive plans that pay attention to aging and children? And we find it's places where they engage elders and children, they participate in these processes, these planning processes, and places where you have leadership from community leaders, people like Cooperative Extension, people like your city manager, and your development community. So you can think of this as also giving you a theory for this work, and this is why I go back to the beginning when I say that list of criteria that WHO and UNICEF think are so important. The ones that are the most important are engagement and community leadership. That is what Cooperative Extension does. If you get that piece right, then you're more likely to have a community that's willing to put these goals, these visions, these dreams into their comprehensive plan. If those things are in the plan, then you're more likely to get zoning rules and regulations that articulate that vision in real terms on the ground. And if those regulations are in place, backed up by vision, backed up by community engagement, you're more likely to get implementation. So yes, implementation is a problem. It's always a problem. And you can have a police function to make sure implementation occurs. That's very expensive. Or you can have a norm-based function to make sure that implementation occurs. Norms come from values and participation. That's why, again, I'm back to the foundational role of leadership and engagement. That changes norms. The articulation of those norms is expressed in the vision and goals in a comprehensive plan. That gets expressed in actual rules, and that gets expressed in conforming behaviors. So it all backs up to what Cooperative Extension is, I think, best at.
So Mildred, do you have some examples of associations that may have, you know, what is their approach? How do they, what's the first step in building some of that relationship and engagement with local government?
That is not the question to ask me. I'm a researcher. What I can give you is the state of the landscape across the nation and what I see connecting to what in a statistical way, even though I haven't bored you with the statistics here. But I am not a Cooperative Extension field-based educator, and I am not the one who organizes those meetings and can tell you those stories. But I know that we could do a focus group around these issues, and we could have a fabulous, because the expertise on this issue, to answer your question, Celeste, is sitting on the other side of this phone call.
Well, I realized that as well. I just wondered if there was anybody that you may have been working with and had some suggestions. So do you want to hear more from these comments, or do you want to move on?
Well, everybody can see these. If you'll just roll them up so I can see them too,
yeah.
Then I might be able to respond to a couple.
I can make this bigger. Close down that, and there we go. That'll help?
Yep.
So because sometimes the chat doesn't appear in the recording, I will go ahead and read them. So from Bev Mancuso, how about some places where this has been successful locations? And from Vanetta, our Complete Streets Board is working on changing sidewalk policies so that there will be an opportunity to cause change. Case in point, 2 large building projects lack sidewalks, as without policy. Building sidewalks was voluntary and not enforceable.
Yeah, so the value of a rule is it helps encourage people who aren't thinking about it to do it. The disadvantage of a rule is that it gets stuck in place and in time, and rules that don't make any sense are still on the books, and some of them we need to get rid of. So, periodically you have to clean out your rule inventory and get rid of some of them. If you're looking for places that have been successful, that's not the kind of research I do, but it is the kind of research that's very popular for most of your big associations. So I was on a national conference yesterday in Phoenix, and my colleague from AARP was there, and they've got a whole list of, champion communities that have led in this effort, and they've got it all up on their website, and you can go read about them. And that can be very helpful because you can say, oh, okay, here's somebody I could call, I could follow up. The same way on APA's website, there's a lot of material on this. But case studies are not what I actually focus on in my work. So I'm not the one to come and ask you the particulars. I can tell you that, back in 2008, when we did a national survey on family-friendly cities, we had an open-ended question at the end, and 60% of those who answered the question, what are you doing, told us about safe routes to schools. There's a little federal money for safe routes to schools, so you do safe routes to schools. A little money really helps grease the wheels on this thing. It can be something that can lead you. One of the areas that I wanted to talk about, which is in the next slide, is the need for cross-agency partnerships. So what's going on here is when you think about, the academics like to use this fancy term called intersectionality. The notion that the intersection between age and gender is important, or the intersection between what the library does and the Parks and Recreation Department does, or increasingly now what the Public Works Department does, and the storms and the sewer department, because we have all this issue around stormwater. The 21st century, if the 20th century was all about silos, let's have a special program for kids and a special program for elders. Let's have a special child care resource and referral agency and a separate economic development agency. You can really think of post-World War II about creating silos. 21st century is about integrating across silos. Now, here's where cooperative extension's the head, because for the last 100 years, y'all have always been about integrating across silos, but we really need it now. And if you look at this list of this is asking the city manager, are any of the following agencies involved in cross-agency partnerships to serve children and seniors? And the likely suspects are at the top: libraries, Parks and Rec Department, school districts. Okay, that's good. Then you have police department, ranking up there pretty high. Your area agency on aging, you'd expect that. Public health department, hospitals and healthcare providers. Boy, with the ACA, the Affordable Care Act, they're required, hospitals are required to spend money engaging in community health activities. Some of them are paying for these informal transportation networks to help people get people to services. Your fire department. These are your biggies. Then look at the bottom of the list. Your transportation or highway department. When so much of our conversation today has been around mobility, guess who's not at the table for this discussion? The guys, sorry guys, but the guys in the highway department who still think it's all about cars. Who else is not at the list? The planning department, the economic development agency, housing agencies, but only in cities. Your child care resource and referral agencies, I think, again, because they've got a narrow focus around child care. So it's the bottom of the list, frankly, where I think we have a lot of our engagements, and we really need to get these departments out of their silos and working with others. If we're going to address the intersections, because we do need to address the intersections across services, across age groups, across populations, if we're going to get to a multi-generational planning approach. So one of the things that I was particularly interested in was the possibility of shared services. And in this case, I'm talking about shared services between your public school and your municipality. And so we asked on this national survey, do schools and local governments share any facilities? And surprisingly, that's more likely in metro core places than rural places, when I would have thought it would have been just the opposite, but it's not. And then we said, okay, maybe you don't share facilities, but maybe you share services. Maybe services are offered in your public schools, like child care. Well, 2/3 of metro core communities do, and 1/3 of rural communities do. That seems backwards, since child care is in worse supply in rural areas. Adult education, of course, you know, schools are only about educating K to 12, but half of them do some kind of adult education. Why aren't all of them? Parents need education too. Recreation programs for all ages. Yeah, again, rural does the least. Nutrition programs, meals for seniors. There, rural stands up a little higher. I know in McGraw, I think it's McGraw, uses their lunch cafeteria for a senior congregate meal site because there isn't any other congregate meal site with a certified kitchen available. Healthcare services for all ages, again, out in Cooperstown, the Bassett Hospital has a number of healthcare services, though they're just for the kids in the school. But using your school as a resource for the rest of the population. This, I think, is going to be particularly important in suburbs and rural areas where the overlay of services is the least. So we also did a survey on community school shared services in New York State, and we did this with John Sipple and the Center for Rural Schools as well. And what you'll see from this survey is that we're asking the school superintendent if their school district shares any of these services with their community. And do they do it with a community group or a nonprofit like Co-op Extension, or do they do it with the municipality? And you'll see youth recreation and Even Start, adult recreation, and adult health care and social services and community feeding. Those are sort of the bigger ones. Community transportation, very little. Adult education, shockingly small. But 70% of school districts share at least one service with their community. If they have a formal agreement as opposed to some informal handshake agreement, they're more likely to share. And sharing is highest in the rural and small city districts, which helps because those are the places where this is probably most needed. You know, most of our communities don't have any transit system. And every community has a transit system called the school bus, but we don't let anybody ride on it except ages 5 to 18. So you could imagine, we really need to start reimagining how we use services and how we blend across age groups and across interest areas because, like I said, most of our communities don't have a transit system, but in reality, every one of our communities has a transit system. And maybe we could think about making that available for more people. Now I see we've got a number of chats coming up.
So there's a new one from Kaylin. I think it would be valuable to include churches in the agency assessment. I didn't see it on the list.
Well, the church isn't an agency of local government. And on a chart that's not here in this PowerPoint, we ask what institutions people trust. And does your local government use those institutions to get information and services to your residents? And churches are definitely on that table. I just don't have it referenced here in this particular PowerPoint.
Okay, she says, got it, thanks. So and that's probably on your website.
I'm not sure if that, it may be. It's been a while since we wrote an article on this that was on our website quite a long time ago, and I think that I know it's in that question. I'm just remembering what was interesting to us is that schools, of course, were a place that was supported, that was trusted by families with children, but not by elders. Retail was actually important. You don't always think of your retail establishments as a resource, but it is because people go to their pharmacy, they go to their grocery store, they develop a sense of trust around those groups. And I'm sorry, I don't have that sitting right here with me, but churches was definitely on the list. It was more, if my memory serves me correctly, it was more important for seniors than for families with young children. I think the church attendance rates are higher generally among seniors. But yes, it is an important resource. Moving on. We also ask about barriers to joint programming for different ages and, of course, lack of funding because we have these segregated funding streams that don't recognize the intersectionality of problems. Then there's this concern about liability, and you hear that in the focus groups. Oh, we can't mix children and elders because of liability concerns for child protection or for frail elder protection. and or schools saying, oh no, we can't have that event in our school because our liability insurance wouldn't cover it. Bull. Your insurance covers you. Tell your school people, and there's been national studies. In fact, there's this group called NPLAN, N-P-L-A-N, that looks at the rules for every one of the 50 states on school liability if people other than age 5 to 18 who are students at the school are there and hurt themselves. Your liability insurance has you covered. We got you covered. Local governments know that they're covered for all age groups. Schools, because they primarily serve kids, think they're not covered for other age groups. It's not true. It's not a problem. And in fact, when we run regression models, we find that places that do more rank liability relatively high, but it doesn't bother them. It's not something that's going to kill this. The regulations to protect children, frail elders, this does not have to be a barrier. Funding is the barrier. That partly means changing government attitudes at higher levels than just the local government, which are going to be harder to reach. But we're talking about a revolution in how people think about things here, and so we need to start moving on that. Okay, so that's about joint use. I think that's one to really push on in New York State, because we have heavily decentralized school districts, and for many of our, especially our rural communities, the school might be the only decent building in your whole community, and it could be much more widely used, and I think there could be a lot more potential to move here. We have a whole issue brief on joint use with schools using the New York State data. You can find that on the shared services portion of my website. And I think it's just one to really push on. Unfortunately, Governor Cuomo, for all of his pushing for shared services, does not value schools sharing services with their communities. And so your school is not being incentivized to share in the way that your local governments are being incentivized to share by the governor's big campaign, actually, for shared services between municipalities. But he has zero interest in promoting sharing between schools and communities. And in fact, if there's sharing that goes on, it doesn't count toward the tax freeze rebate program. So, which is something that, might also change. Okay, let's switch our attention to gender for a minute. We don't ever talk about gender. I've been talking about gender a whole lot today, but it's really something that we don't talk about a whole lot. And we don't have courses on it at Cornell in our planning department anymore. Many of the practicing planners who've come out over the last 20 years have not been trained to think about a gender lens. And so people are like, what's that? What's the difference? Does it matter? And so I want to talk about that for a few minutes because we've done that work with planners as well. So why do we need to look at gender? Well, women face a triple burden. And some of you guys out there who have actually changed your behavior, not just your attitudes, you'll feel this burden as well. And this is the burden. You have household responsibilities of child care and elder care. That's the sandwich piece that we're talking about. And that means that your labor force participation is both your formal job, like me and Celeste sitting here working for Cornell, and those of you out in the field working for Cooperative Extension, and then all your informal work that you also have to do. But the economy isn't set up to support your informal work. Our formal systems are only set up to support the formal side. So the informal, you're just sort of doing on your own and making do. And then we have the triple part is the spatial constraints. Back after World War II, our planners decided that we should separate homes into suburbs and work into cities. And that the home would be where the wife would stay back and take care of the kids, and women were forced out of the labor force when men came home from the war, and forced into suburbs that were race and class segregated, and separated, this physical separation of home and work. Now, most of us now also commute great distances to work. The notion that you would work near your home is just not true for most people. So we spend huge amounts of our day commuting. And this makes it more difficult to attend to care needs, to get groceries. Life's really stressful. And the spatial divisions and the time lost dealing with those spatial divisions is part of what makes life more stressful. And so this is what we call the triple burden.
And I thought it was just me.
No, it's not just you. So what we did is a couple of years ago we started working with the Planning and Women Division of the APA, the American Planning Association, and we began to define what would be gender-sensitive land use actions, and I'll get to those on the next slide. And we wondered if communities that had more gender-sensitive land use rules would have comprehensive planning that addressed the needs of women and aging, and would have community attitudes from developers or the planning and zoning board that were more gender conscious. What I want to draw your attention to is that only 2% of the 624 planners who responded to our sample, only 2% said that their community had any language in their comprehensive plan that paid attention to the special needs of women. We're more than half of the society, but we don't deserve special attention in a community's comprehensive plan. That's a sorry, sorry state. By comparison, other OECD nations, which are all the advanced industrialized countries, most of them have something they call gender proofing or gender mainstreaming, which requires government agencies to think about every policy that they make, whether it has a gender difference that should be attended to. The U.S. is unique, once again, in being a country that doesn't think that's necessary. And that's part of what leads us to the blindness and the ignorance about gender. Even Celeste and I, as women, probably are pretty ignorant about these issues. Like Celeste just said, oh, I thought it was just me. By contrast, with aging, over half of the responding planners said their communities had language that was giving attention to aging in their comprehensive plan. Something cool. Aging is opening up the way we think about planning. Let's go on to the next slide, because I'm sure you're dying to know what a gender-sensitive land use might be. So we began to think, well, what would it be? It would be things like allowing child and elder care in residential zones by right. Duh. If residential zones are where you live, shouldn't the care services to support the children and elders who need care be in the residential zone? Well, look at the numbers. 46 allow it by right for child care and only 37 for elder care. I mean, that's something that's just got to change. So on the one hand, we're excited about zoning rules that can help you move forward, but then there's also these other zoning rules that stick you in a place where you don't want to be, and those need to change. On transportation, 73% of the transportation plans say they address mobility management. That's good. But only 56% address trip chaining. And if you don't know what a trip chain is, it's when you get up in the morning and you drop your kid at child care, then you go to work, then you stop at the grocery store, then you pick up a kid at child care, and then you go home. But your transportation planners are planning for what they call journey to work, which means home to work to back again. And that's not, women don't do that kind of a direct trip. They trip chain much more than men. Expanding housing options, we've talked about the accessory apartments, and on this survey we found that 30% of respondents said their communities allow accessory apartments, but only 16% said their communities allow retrofitting single-family homes into homes for two families. Family definitions. Why the heck planners ever got into the business of defining what is a family? Actually, that has also racist and sexist and homophobic sources to where that came from, but it just doesn't have a place in today's society. We should not be determining what is a family. That's got to go. But it makes it very difficult because we have, for example, one of the elder housing strategies is what they call, kind of a tacky name, they call it Golden Girls, where 4 unrelated older women live together. That's illegal in most communities. And you know where that comes from? Regulating the number of women who can live together was to prevent brothels.
Oh my goodness.
Yeah, and so a lot of communities still have on their books old rules that say more than 3 unrelated women can't live together. And yet one of the things that we're pushing for nowadays is the thought that if you're in this big old suburban house, maybe you could share it multiple ways and you all could also provide informal supports to each other.
Interesting. Mildred, I'm sensitive to time here.
Oh my gosh, I'll be very quick, I've got 3 slides.
Okay.
So what drives gender sensitive land use? Comprehensive planning. Click. But actually it's not comprehensive planning, it's comprehensive planning that gives attention to aging. That's what drives gender sensitive land use. We also looked at community attitudes, planning and zoning board, developers, whether those are gender conscious. Those matter a little bit, but what really matters is comprehensive planning that gives attention to aging. And we also controlled for planner gender. the individual planner's attitudes and the community demographics, and we found out those don't matter. So the message here is that gender rides the aging train. Aging, if your community starts to give attention to aging, it's going to open up the way it thinks about the issue so that a more gender-sensitive result can occur. And so you don't have to name it gender, you don't have to be some raging feminist. You can just say, we need to give attention to aging. And older people have different needs, and that'll help your community move towards something that's more gender-sensitive.
Excellent. Love strategy.
The extension's role in all this is critical. Leadership and engagement is what leads to everything else. And leadership and engagement, that's what you do. And this is a similar version to what y'all saw earlier we talked about at length. But leadership and engagement, that's the core. And we'll go to the last slide where you can hit again to the website, mildredwarner.org. But again, it's this comprehensive approach of thinking about the physical design, shared services, a common vision, and a new paradigm that talks about planning for all ages, not just older, not just those of us in the sandwich, and not just the young children. And there's a whole bunch of issue briefs on my website, all available for you. And thank you for your patience.
Oh, this is excellent. Thank you so much. So a question came in. Can we get a copy of the slides? Is it okay if I post slides?
Sure.
I can post them as a PDF if that.
Sure.
Okay. All right. And I will post that. And we'll also post the presentation as well. Thank you very much. And you can continue to send questions in. You can contact Mildred if that's okay, if they contact you, right? I want to take just a quick moment to bring you back to the Campus County Connections website. So if you want to know where to find the recording, give me a couple of days. I have to convert it to an MP4. We have to post it to our YouTube site, but it'll be posted here. So if you go to the staff site, staff.cce.cornell.edu, click on Units and go to Organizational Development and Accountability. Campus County Connections appears on that page, and all of our recorded webinars from Campus County Connections are there, as well as the upcoming webinars and a place where you can register for those. So thanks so much for participating, and thank you once again, Mildred, for joining us.
Well, thank you. It's a pleasure to be part of it.